Entry and exit chimes are off. Entry and exit chimes are on.
Welcome, everybody. It's Dr. Brooks. I'm really excited about tonight. I've got a lot to share with you. I actually ran out and got a coffee so that I could be as awake as possible, because we got a lot to talk about. I have a lot to talk about. You have a lot to listen to. So I did go ahead and attach the little handout for tonight. There's just a couple slides and then some more information on some of the things that we're going to go over. So most of this, though, you're going to need to take notes on. So please be prepared to do that if you want to grab a paper and pen right now so that you can take some notes. Of course, attending all of these parent webinars are free if you attend them live, and then we charge $15 to listen to them, the recorded version. So if you feel like it's something you want to listen to again, hopefully we can have that up under this week, and you can listen to it any other time that you want. So let's get started. I'm going to full share my screen to you so that you can see what's going on. Okay, so here we go. Ta-da! Okay, so we're going to go through MTHFR tonight and kind of what it has to do with development, cognition, detoxification, and supporting pathways. We're going to go through, I did this in February, and it was actually the first month that I did a webinar, and we had a lot of parents not be able to attend. I was kind of trying different times out and such. So I decided, because I'd had so many parents ask, and I know many of you have gotten this from friends and family, so thank you for attending. I wanted to go ahead and redo it from February and add in a bunch of stuff that I didn't get a chance to do at the time. So hopefully you're all ready. This is warning and disclaimer. Obviously, this is for informational purposes only. I want you all to be very careful. I assume everyone on the call either has MTHFR or they have a child with MTHFR. So please be really careful about supplementing your own children, giving them things without I guess, supervision of a doc. Anyway, so none of this information is to be used for you to treat your children tonight. We're going to talk very vaguely. I really want to give you the background, education, things you should watch out for, things you should ask about, testing you should think about doing, talking to your doctor about, etc. Also, reproductive rights. This is all my information. So if you want to use it or duplicate it, you'll need to get my written permission. So before we get started, I wanted to tell you a little bit about myself and my practice here. For those of you that may not know, if you guys could mute your line, those that are joining. How do I mute the line? I've never been able to hear anybody. Let's see. Nope. So if you guys could just mute your line for those of you that are coming on, because I can't seem to figure out why it won't do that. They actually upgraded this system a couple weeks ago. So obviously it's somewhere where I can't find it. So anyway, back to business. Want to go through a little bit about what we do here in the practice. And so maybe you can find someone similar in your area if you can't get to us. So I own Whole Child Wellness Center. We're a pediatric only practice. And I really focus most of the patients here, early intervention, developmental delays, behavioral issues, etc. So my approach is really integrative in that I bring in the chiropractic and nutrition, development milestones, things like that. And the biggest thing is that we look for the underlying cause of symptoms. So I think that blending both really gets kids better. So whether you find an alternative, wow, that was weird. So whether you find an alternative doctor, you may want to see if they will work with your traditional pediatrician to give you the best care possible. I am a board certified pediatric chiropractor. That's my license. I'm also a registered nurse. So I have a little bit of the both sides kind of in me and my brain, if you will, to kind of add to the mix. I did author a book, 15 Things Your Doctor Doesn't Know About Your Child. So I'll show you that a little bit later. I did start a Healthy Kids Nutrients, a line for children. So you can check us out there. Mostly on Facebook, I post things that are applicable for parents and doctors that want to pass along information to their pediatric clients and parents. So if you haven't, you can find us on Facebook at Whole Child Wellness. And then I also do YouTube videos every week, and I post them to our Facebook. So I'm a big YouTuber. I love it. It's really like one of those things I do late at night when I've got nothing to do or I can't sleep. But you can find us there at Whole Child Wellness if you're a YouTuber. So objectives for tonight, we are going to go through what a genetic SNP is, going to take you through some basics. What is MTHFR? How common is it? Common symptoms, functional testing, what to do and to avoid. There is more of what we're going through tonight. I just didn't go back and kind of put it in here. Kind of got on a tangent, for those of you that do presentations, you know what I'm talking about. So there is a lot more than just this, but these are kind of the basic overview. What's a genetic SNP? I think this is really important. One of the parents said to me last week, isn't that a short, isn't that like a really long word? I said, yeah, so it stands for single nucleotide polymorphism. And it's just it's when we take, for those of you that have done a 23andMe test, it's looking at the SNPs versus those of you that have had genetic testing done on your children. It's looking at the larger genes themselves. This is just taking a little snip of that and looking at it. So some things to know about SNPs, they occur in both coding and non-coding regions or between genes. So some people have said, we did a full genetic panel on my child and they have nothing wrong with them. That doesn't mean that they did the SNP testing. So it is very different. Of course, SNPs vary in terms of severity and benefit, right? Due to where they're located and the redundancy of the SNP itself. Most of them do not govern genetic function or expression, but they are involved a lot when we're talking tonight, we're talking about mostly methylation and detoxification as far as the MTHFR is concerned. So there is a way to bypass these SNPs, if you will, because the genetics we can't fix, but we can bypass the routes, if you will, to really focus in and concentrate on the things that they need so that the products that are supposed to be produced in that cycle are actually being produced adequately. So that's really the goal of what I do and what your doctor would do for you if they're helping you out with MTHFR. So just a little bit of genetic vocabulary. I really should put this on my website because it's really important to know the difference between these, especially when, if you're calling around looking for someone to treat your family or treat your child. So when we talk about epigenetics, it's the semi-permanent, which don't affect DNA themselves. Nutrigenetics is how specific polymorphisms affect nutrient needs or metabolism. So the example that I used, because we're talking about it tonight, is MTHFR. And then nutrigenomics is really what doctors do. They really look at specific nutrients that change the gene expression that really help support those pathways to work. So they look at the genetic side of it and they look at the nutrient deficiencies, GI function, et cetera, to make sure they're looking at the whole clinical picture. So that's what you really, really want for yourself or your child. So in future, I went to a course or a lecture a couple weeks ago, and he had given out this information. I thought this was so interesting. So I guess there was a Weston Price cat study that showed that epigenetic factors alter gene expression, and it actually takes 3 generations to reverse. So a lot of times parents will say, well, why was I okay? Or how was my brother and sister okay, but my children aren't okay? And this is really what they're trying to study in the lab, is how many generations does it take to fix these things? Or if so much of the population has MTHFR, at what point are we able to get it out of our familial passing on, if you will? So It's really important to remember the number of health conditions, including autism, which I'm sure a lot of you have read about, the link between autism and MTHFR. It's really, really important that you look at the entire methylation pathway as a biomarker, because that just because they have MTHFR doesn't mean that we know what the disease state is, right? Or the genetics. We just know there's a genetic susceptibility, but we really don't know in live true color what that really looks like. So it may really require expanding the views into other biomarkers, which I will always walk parents through. If there's red flags in certain places, we'll run testing to make sure the entire pathway has been connected, so we know if there's any functional issues that need to be fixed. So you don't just want to focus on the fact that you have MTHFR. You need to look at everything else that's included. So these are some basics we're going to go through. When people talk about methylation, there's usually cycles, 3 parts to that cycle. The first is the methionine cycle. And I just gave you the easiest chart that I could find. And when you Google this stuff and look for images, it's atrocious, the stuff that you can find. So I did pick something rather straightforward. Basically with the methionine cycle, you can see methionine over to your left in the box. And then you see adenosine methionine and the adenosine homocysteine and then homocysteine, et cetera. So it kind of goes in a big curve, right? And so we know the S-adenosine methionine is SAM and the other one is SAW. So a methyl group's given up in this methionine cycle, and it's used for various other reaction pathways, hence the methylation cycle. There's really important cofactors that drive this cycle that this actually doesn't show. The cycle really needs folate, B12, and B6. So these are things that you're going to hear me mention a lot this evening about the B vitamins. So I wanted to mention it here because we're going to talk about it later. So these are kind of the basics, if you will, of the methylation cycle. I did give you a downloadable notes in your chat box that you can press on, and I gave you the full methylation cycle that we're going to go through. So if you just have that in front of you, you'll be able to find this and kind of follow me through the different cycles that I'm going to go through. I just thought for ease that I was going to break them up as we go through them one by one. The second and third parts of the methylation cycle, first, the third are folate pathway and transsulfuration pathway. So these are your folate, which you see the folate cycle to your right, and the transsulfuration pathway down at the bottom. So methionine we just went over, right? You have methionine, SAM, SAW, homocysteine. B12 connects it, which we just mentioned B12, and then you have folate. So you see the MTHFR in the circle to the right. This is where things can go awry genetically, right? Susceptibility. However, we know that when we test children or adults in this case, for those of you that have MTHFR as well, we know that there could be anything wrong with any of this part of the cycle. And that's really what we need to find out. There's lots of great testing, which we'll go through tonight, things that you can ask your doctor to order. And of course, every doctor has their own way of doing it. If they are a doctor that's familiar with treating children with MTHFR, they'll probably use the same tests that I do, if not something very, very similar. There's only so many labs that do these tests, so there's really only so many options that you have. So this is a little bit about what that pathway looks like. The transsulfuration pathway really is much longer than this. However, this is kind of a tweaked down version of it. I want to point out one thing in this cycle that's probably the most important is the glutathione. At the bottom of the transsulfuration pathway is glutathione. That is an amino acid that's needed for detoxification. And a long time ago, when I was first in practice and seeing a lot of children with autism as I do today, we would give glutathione pretty readily because it was in the very end of the cycle. And now we know that there can't be really any harm that comes from giving it 9 times out of 10. But now we know so much about MTHFR and how there could be something way up in these pathways that you can see that could be really making glutathione the issue, right? It might not be just a lack of glutathione. There might be something way up here in these cycles going wrong. So it's kind of where where we've come from, I'd say the last decade, to where we are today, really investing our time in looking at these cycles to figure out, just because my child has MTHFR, it does not mean that there is something wrong with them and that tells us what's wrong, because it doesn't, right? So the testing is going to tell us what exactly in these cycles are wrong so we know what needs to be fixed. And again, we'll go through those tests later on this evening. So for those of you that don't know, it's a very long word, right? Methylene tetrahydrofolate reductase. This is a genetic mutation or a polymorphism. Both are used interchangeably. First discovered as a result of the Human Genome Project that was started in the mid-90s. The C6770 was found in 95 and the A1298C in 2001. So obviously this isn't something we've known about for a super duper long time. People that have this mutation have an interruption in the methylation pathway, which is what we just went through. So somewhere in that pathway, there could be an interruption. And there is many times way more than just one interruption. And those of you that have done the testing with your doctors or even with myself have seen for yourself how very messy these pathways can get. And of course, it gives you a reduced ability to process folic acid or folate into something their body can use. So we're going to talk a little bit about folic acid, what it is, what version's bad for you, what version's okay for you. We're going to review that because I know we have some newbies on the phone and then we have some that are, that have been around the block, so to speak. So let's talk about what it is first. Approximately 45% of the population has one copy of the C6770 mutation. That actually includes myself. I have one copy of C6770. It does run higher in Italian, Asian, and Hispanic cultures. So there's something, at least that's what they've discovered in doing research. Heterozygous, just for those of you that don't know, that means you have one copy of the gene from either parent, and then homozygous, one copy of the gene from each parent. Most commonly, anyway, although there's some exceptions. So I put in green here the C6770 heterozygous, that's one copy, right? That means there is a 40% loss of function on the MTHFR gene. So that could be a loss of function anywhere, again, in the methylation cycle. For C6770 homozygous, meaning you have two copies, it's a 75% loss. So you can see that having two copies versus one is a greater loss of function. The A1298C hetero is 1 and homozygous is 40. Now, the worst case scenario that I will often see just in treatment and symptomatology is what's called compound heterozygous, which is you have one C6770 and one A1298C, and that's a 40% loss of function. The one that they've made, I guess, as a risk factor for autism is the C6770. And I'll show you some of that later tonight. But I have found, those of you may know, those of you may just be getting started with your children, but the children with MTHFR tend to be more sensitive in general. I always tread a little more cautiously with my compound heterozygous kids because you've got both of the mutations having their own issues with C6770 and A1298C. So sometimes they go beautifully with treatment, and other times whatever doctor you choose to help you, that you exercise a lot of patience, because you can only go as fast as your child's body will let you. And that's the hardest part, is patience. So let's first talk about the A1298C mutation. Roughly 30% of the population, as we discussed, MTHFR, the 2 pluses mean homozygous, is more common. So usually that will lead to an impaired synthesis of serotonin and dopamine. So those are the children that are going to have issues with behavior and sleep, kind of modulating those. So those will be, if your child's having issues with behavior, these pathways are directly linked to your neurotransmitters. So it tends to be something just a little more sticky that you need to deal with there. Methylfolate levels might be normal when they're tested, and so may homocysteine. So again, you may get, if you just do some basic blood work, you may get the feeling that everything is going okay. Of course, as you will learn this evening, that's not always the truth. You will and may see with the A1298C elevated ammonia, gut dysbiosis, which is basically imbalance in the gut, right? Not enough good bacteria, or there's a bad bacteria growing, or candida, yeast of some sort growing. Aluminum toxicity is often the case, and heavy metal issues. So it's always good. I always do heavy metal hair testing with the kids just to make sure there's not anything that they're getting a hold of from a toxicity level. And then these are some of the other associated symptoms that they've been able to make as they've dug deep and researched a bit: depression, anxiety, IBS, et cetera, et cetera. So you may be reading this and say, oh, we have a family history of dementia, or we, so-and-so schizophrenic, or what have you. So obviously, most of these are showing up in adults, not necessarily children, although I do have children coming in with depression and anxiety, and of course, irritable bowel stuff. The other ones, not so much. It's more of adult thing, I guess, except neurotransmitters, which can be a hot mess with kiddos too. So the C6770 mutation, this one's clearly significant. Folate alone is not the answer. So it's one of those things where giving it may exacerbate the deficiency itself. So what I always tell parents is I have had families come in that have just come in with knowing they have MTHFR and they want to do methylation support. And I say, until you address the inflammation, you can't really address any of the methylation issues, because so many of these things will backfire on you. So it's really important that you understand, if this is something you're going to take on, you really should be figuring out if the gut's okay, and then working from there. A lot of the neurotransmitters, a happy gut means happy neurotransmitters, right? So if your kid's acting crazy town, it may actually be a gut issue, not really a neurotransmitter issue. So that's something to really think about. And then, of course, inflammation, it really makes it hard for methylation to work when there's lots of inflammation. So those underlying GI issues, when they're cleared up, you will be so thankful, because your methylation work that you do will pay off. And I have so many families that could be a testament to that within 60 days, they are very, very different children than they came in. But most of them, have done GI work before me and are really coming to me specifically for the MTHFR work. So depending on where you are, you're going to have to exercise your patience, because you want to make sure you're doing things correctly. Clinical applications for C6770, you may see higher homocysteine, which will increase heart disease, stroke, etc. During pregnancy, you may have more children that have placental issues, preeclampsia, neural tube defects, and cleft lip. Also, they've made a correlation with lip tie and tongue tie, which I first put in there. So that's something if I have an infant right now in the practice that's just a couple weeks old, and they're having that issue. So I told them, when you go back home, you need to follow up with the doctor and have them tested for MTHFR. Very, very, very important, right? If we can get them young, we can keep them well. Peripheral neuropathy, inhibited glutathione production. This is really, really common, of course, right? But if we just give you glutathione, it may not fix your problem, because there's a production problem, which we kind of addressed earlier. Low methylfolate levels, of course, and then altered DNA regulation. So these are just some of the things, for those of you that have done testing. I kind of wanted to make the correlation for you. Those of you that haven't, you can see kind of the importance of looking at this from many, many different angles. The C6770 mutation, I did mention autism spectrum disorders earlier. There has been a link to the C6717 autism. There's a 2.79 time risk increase for those with C6770. Now, for those that have it, does it mean you're going to be autistic? No, I have the C6770 mutation. I'm heterozygous, and I do not have autism. Neither does anyone in my family. So that doesn't mean if you get your child tested when they're 2 years old or 6 months old that they're going to have autism. So don't panic, but do get help so that you decrease your risks, right? Because we know that detoxification is an issue with MTHFR. We also know detoxification is the biggest issue with children with autism. So go figure that they're related. And then, of course, when compared to the controls in the research study, they found that there was a 25% increase. So just something to note. So what's the real difference we know? The C6770 specifically affects the conversion of tetrahydrofolate into 5-methylfolate, whereas the A1298C does not affect the folate production, but it inhibits the reversal of the production from 5-methylfolate back to tetrahydrofolate. So what happens is in A1298C is that produces one molecule of BH4, which is called biopterin. And in that little, in the notes that I attached for you guys in that chart, the very, it's a methionine cycle, folate cycle, biopterin cycle, which is BH4, and then you'll see neurotransmitters. So that's how you can see how affected, right? You see the methylation pathways or the methylation at the top, and then you can see the neurotransmitters down the right-hand side of the one that I sent you. So you can just click on that link and open that up. Of course, that's why behavior is affected with children, because neurotransmitters are directly affected with the children with MTHFR. So what does folate do? Why is it so? Well, it helps in DNA production and repair. We'll go through methylation. You'll kind of see it again in a chart in a few slides. It does have a lot to do with amino acids. It's how neurotransmitter production and detoxification happens. So if folate's not working that great, then neurotransmitter production and detoxification may be a huge issue. The formation and maturation of red blood cells, white blood cells, and platelets. So sometimes you'll see these off in the blood work and not make the correlation to folate or to MTHFR. So it's definitely something you're going to want to make sure every doctor, whether they know what MTHFR is or not, that you do disclose that to them, because that actually might be the reason why you're having some abnormal CBCs. Folic acid does not equal folate. This is really important. So folic acid is the synthetic form, right? It's what the body must convert. The body has to convert it if you give it the folic acid form. So you never want to take folic acid or any supplements with it. You only want to use active folate. So your methylated folates, your 5-MTHF, your 6-MTHF, all those are good. Folinic acid is also an active form of folate, so not to worry. If you're running your tests and some of like your folic acid levels are low, you'll want to get those in food. You're not going to want to get those in, by taking folic acid. So common symptoms and conditions. These are things that have been brought to the forefront that really have to do with, I guess, MTHFR and making that correlation. So we've talked a little bit about autism. Some of you that have MTHFR, you may notice that your children are kind of brain foggy, delayed speech, of course, headaches, insomnia, etc. Some of the things, I can't really tell you that I can look at a child and say they have MTHFR, but often if I spend an hour with a patient and they don't know if they have MTHFR, I'm pretty convinced or not by the end of that hour that, what I think their percentage of having it is. Unfortunately, more times than not, and it's probably just the population of children coming into my practice, more times than not, they do have one of the Snips. So I always say it's worth testing your children for and ruling it out as a potential underlying issue that needs to be addressed. This goes on. They found so many things. I added to this since February, in just some things. I didn't put everything down, and I wanted to put some of the things that were more adult related for obviously, because as the parent you're attending, and more likely than not you have it as well. So just some things to kind of bring to mind for yourselves. Like I always say, everyone in my family that I know of has died of cancer. So go figure, right? They haven't exactly specified what types of cancer. For those of you that may be asking that, I really don't know the answer. They've just kind of blatantly said cancer, which I know is like, saying, I don't even know. It's just it's way too big of a topic. The methylation is responsible for lots and lots of things. We've been through some of this. Some of the things I just want to touch upon from a behavioral standpoint. We've talked a lot about neurotransmitters, specifically norepinephrine, epinephrine, and serotonin. Some of you may be giving melatonin, for example, to your children to help them sleep, which is perfectly fine to do. There hasn't been anything that any of us clinically have noticed with melatonin being adverse with MTHFR, just as a side note. But it's a lot of the children also suffer with chronic infections, trouble with immune cells, immune, regulation, etc. So that's definitely something. If your kid had chronic infections or has a history of them in any way, that might be something that you'll that you could look into a little bit more. And then one thing that really gets me all the time is the very bottom one, which is maintaining cell membranes. Some of the testing that we do can tell us if the red blood cell itself is leaking folate out, which is really, really important. If it doesn't have what it needs to fatten up that cell membrane, it can't hold on to the things that we're giving the children, right? Phosphatidylcholine is great. So is vitamin E. Your omega fish oils that you're giving the kids are also really good for cell membranes. So just a couple things as far as functions go. There are so many more functions of the methylation pathway than I could even list. So it wasn't really worth going into because there's so many more things that are, I guess, a little more easy to understand than these. But I wanted to give you kind of a sprinkle, if you will, of some of the functions that could be impaired. So methylation issues do affect detoxification. They do affect behavior and mood. They do affect development, allergies, and immunity. We're going to go through each of these, and I'm going to kind of give you my play-by-play of each of these just from what I've seen. So this is the attached for you all with the methylation biochemistry. This is the one that I use in my practice for my patients because I just love that it's labeled really nicely. It shows just enough, not too much to be a little crazy, if you will. But we started by talking about the methionine cycle, the folate, the biopterin, which is at BH4, and the neurotransmitters. So a lot of times, we've talked, I think I've hit a lot on behavior as far as the neurotransmitters in relation to the MTHFR. But I kind of wanted to go, if you look here specifically at this is a little bit closer, I want you to look at the aqua or turquoise, like the B12 and B6 in here. The B vitamins are so important in all of the aspects throughout this methylation biochemistry here. B12 and vitamin C and B6 on this one as well in green. Those are the one easiest thing that you can help your child with, is giving them a really awesome, good quality multivitamin that has all their B vitamins in it that's that's really good, and a really good vitamin C. So those are two simple things that you can really make sure that you're getting in to support the pathway. Anything else that needs to be given, of course, your doc can test for and kind of move from there. So this THFR affects allergies and autoimmunity specifically. When methylation is impaired, it leads to abnormally high levels of histamine, which is what gets high with allergies. So a lot of the kids have pretty bad allergies, whether they're seasonal or all the time. And there's certain things that we can do naturally to help with that. And sometimes it's just, just kind of managing the symptoms, if you will. Some of them don't actually do well on medications for allergies because of the other things that are additives in there. So it's definitely something you want to discuss with your doctor about ways to proceed with that. The other thing is decreased methylation increases your allergies by altering your Th1 and Th2 bounce, which are really related to how your immune system is bouncing itself. So I give immune support to almost all the kids to modulate these two things in the immune system to kind of help. It won't always help, but it's definitely something by boosting the immune system in any way you can to support your bounce in those systems is always the best thing. Sometimes, doing basic things like vitamin C is good for the immune system, but it really doesn't help those bounces, if you will. And then, of course, when they're not methylated, the immune system can become dysregulated, which just kind of means out of whack, right? It's not working like it should, resulting in autoimmune conditions, which is why you see things showing up on the list that I showed you earlier, the 2-page list that we went through. A lot of those are autoimmune issues. So this is part of how those things over time can become dysregulated. And then as adults, we end up with autoimmune conditions. Development, the inability to progress through methylation cycles really to build up in the pathways. Glutamate's one that will build up a lot. It's really excitatory, and it's actually happens to be in the pain pathways, which a lot of the kids that come in don't talk. They don't have language. They can't tell us about pain, but they do pain behaviors. And I've talked a lot about that in other webinars that you can go back and listen to. But the glutamate specifically, if you're running testing and that's coming back high, again, you may want to go back and ask the doctor to do methylation testing specifically, because there are great supplements on the market to help with neurotransmitters, but I always tell families that I'm doing neurotransmitter work with, we're really band-aiding it while we fix more of the problem, right? So I'm not saying that supplementation isn't going to help, because it's going to make the household less crazy, but it's not going to necessarily fix it long-term until you get up into those methylation cycles and figure out what's going on. So in studies that they've done, of course, methylation capacity is correlated with increases in myelination. Myelin is what surrounds your nerves, right? So, for example, multiple sclerosis is when the nerves are being demyelinated, myelination's coming off. So it's just things like that, that in development, this is something that's really important to make sure methylation is staying the way that we want it to, so that myelination of all those nerves stay good. And so the brain stays working the way it should. And then, of course, I just explained the demyelination. And then as far as brain and other organs, it's really important that methylation works, because it does have a lot to do with not only detoxification, which we've talked about, but repair and growth. So your SAM, your SAW, and then on down, that first methionine pathway that I've given you all, you can see kind of that pathway down there, but growth and repair is a big part of that job of the methionine cycle. Detoxification, this is one that people are always, I'd say, hot and heavy to kind of get after. Methionine appears to accelerate recovery from anesthesia. So we know that people with MTHFR should not have things like nitrous oxide, right? Gas. So we know that if methionine is not deficient and is doing well, it actually helps to phase that out and detoxify that out via that pathway. It also helps with mercury exposures, which I know many of you have been worried about vaccines or do worry about vaccines, and the mercury that's in those as well. There's mercury in lots of other things, though, not just vaccines. So it's definitely something you can do a little more research on. But mercury is and does interfere production of SAMe, which you can see in the cycle that I handed out to you in the methionine, I believe, kind of to the left-hand side. I'm kind of picturing it in my mind. The next one's behavior. So a majority of the neurotransmitters produced in your body are in the gut. So remember a couple minutes ago, I talked about how important it is for you to get the gut healthy. It's probably one of my hardest jobs with parents is really stressing to them and educating them how important it is that we do things in the correct order. And I know everybody wants to get better right now. And sometimes, depending on how broken the gut is, I can't make it happen fast enough myself, but sometimes it takes some time. And what does that mean? You could be working on GI stuff for 6 to 8 months, depending on the severity. And then you can kind of get in to your methylation work, right? Or your neurotransmitter work in the meantime to kind of help you out. So the majority of your immune system is located in your gut. 70%, that's huge. So this means that gut function and the ecology and balance of that is really the other half to taking care of a child with methylation. So you really should address the gut first prior to doing any behavioral meds or methylation. Now, I have had parents come in that do come in. You may be one of them that may be saying, oh yeah, we're like that too. And that's, you've done urine testing, you've done stool testing, you worked with someone, and you think you're done with that, and you just want to move on to this. And I'll caution you, if you haven't gotten labs since your treatment to really know for sure that the gut is happy and healthy and ready, then for me, I'm going to tell a parent, you have to do an updated urine and stool so I know that it's safe to proceed. So really be ready to do those things. I can't take someone's word for it that A, things were done properly, B, suggestions were made right, or that you actually followed the directions that your doctor gave you, which is, a big part of it, right, is really being compliant. And I know that's tough sometimes. So just be ready to take a look at those labs before you proceed, because that's the responsible thing to do. Methylation. We talked a little bit earlier. I wanted to give you some specific labs. And you can just write down the Health Diagnostics and Research Institute. They do a fantastic methylation pathway. And these are the things that they test. What I love is they do glutathione, they do salmon saw, and then they do your forms of folic acid or folate. So you can kind of tell where your needs are exactly and what we need to do in food, what we need to supplement, and how to do that, kind of how to proceed. And your doctor will obviously be able to dose you depending on your needs. So again, really great test. To suggest to your doctor or ask them if there's a test. I know that Doctor's Data, the CEO and he emailed me and told me they are working on a test to bring together their methylation test, which is just a couple things. I think it's on the next page here, but also to do some of the things that Health Diagnostics is doing. So hopefully in the fall, I believe they will be introducing that, which will save some money for you and really, quite honestly, make it easier for the docs because we won't have to order from 2 different labs. So this will be great. This is a blood test. Number 1 is a blood test, so that's something to note. The Genova test, it's a neoterin and bioterin urine test. This is a great test. It basically tells you the byproducts of those. It's a very simple test. It just shows you neoterin, bioterin, and the ratio of them. But it's something really good to show us if there's how bad inflammation is in the system and how much, if any, oxidative stress is there. And we talk a lot about oxidative stress when we talk about MTHFR on the body, and there's so much that needs to be done to address that if it's an issue. So this is a very short and sweet test, but actually gives us as your doctor a lot of great information. So I love this test as well, and it's urine, so I don't have to take blood, which is always super nice. This is an example of number 3, Doctor's Data. Favorite labs by far, for so many reasons. They're a great company. First of all, they are always listening to what the clinicians have to say about what we need and what we're struggling with. And of course, I'm not very shy about telling them, hey, these are the other tests I'm using and this is why I'm using them. But hey, if you'd come up with something, I would more than love to do that. This is a plasma test. So this is a blood test. And you can see this exactly. It's something I pulled off their website. And it kind of gives you nice color coded. What I love is it gives you this nice chart at the bottom. So many times with our patients, I will make notes for them on this about what's high, what's low, and kind of explain it. But this is mainly the methionine cycle that you see here. And then with your health diagnostics test and neoterin and bioterin, you really do get a full clinical picture, at least as much as we can to date, about what's going on in the methylation cycle. The other thing that you could do, and that really your doctor should be doing, is blood work. And that's to look at your full amino acids and mineral panel, because these tests aren't going to go into that, right? So I am assuming that those things are being done. Okay. I'm assuming that you've had full blood panels done. Number 4, continuing. I love the 23andMe test. So what you would want to do, this does not include an interpretation. I think there's some websites you can plug things into. I would tell you, really find someone, send off the saliva test and get the raw data back and don't do anything with it. Find somebody to interpret that raw data, because a lot of times, like if I'm going to do an interpretation for someone, I'm going to include anything that I need to download or any kind of conversions that I need to do in the cost of what I'm charging you. So make sure that some of that information they're giving you, other things, there's things in addition that I give my patients and go through. But the raw data really is all that they need. Let them handle it from there. What's really happening is, you can imagine, a lot of people are cashing in on the MTHFR bandwagon. So what's happening is there's a lot of sites coming out with, put your raw data in here. And it looks different to you, but I'll tell you, you're getting the same thing over and over again. You're paying for it over and over again. So please don't spend your money. If you're really dying to know, find someone that's going to download it and tell you how to interpret it. Some of those things that are interpreted are telling you things to stay away from or things to give. That is just based on the genetic mutation. That is not based on your child. Clinically is what matters, right? Your history, your clinical symptoms, what you're dealing with, what you're not dealing with. We're not going to treat you based on the genetic Snips that you have. We're really going to treat you based on the symptoms. Can you mute your line, please? Thank you. Where was I? So they can give you an individualized interpretation, things that you don't have to be worried about. For instance, some of them will say, stay away from methyl donors, right? But then your testing will come back from health diagnostics and say, you need methylfolate like crazy. You're totally deficient. So at that point, a parent might say, well, we can't have any methyl donors. Well, that's not true. That's just what your genetic, what that printout said. So those of you that have the printouts, really take it with a grain of salt and get help despite what it says. You will not want to supplement anything based on what you download. Please, please, please don't. There is an art and a science to helping children or individuals at all through this. It's really something I would not do on your own. I can't tell you how many parents have come to me describing their children as psychotic or bipolar or flipping out because they tried to supplement on their own. It's not hard to get your kid to flip out if you're doing this on your own, unfortunately. So please, please, please do not do that. You're really putting them in harm's way by doing it, and in some ways making it harder for them to be treated. So some people say genetic testing, why would I do it? Some people do it preconception as a preconception screening. Others do it when they just don't know what's going on medically. Maybe it can help you. It can reduce your disease risk, right? Because we know what you may be at risk for genetically, and we can make decisions about diet changes, etc. Compliance is important. I think it's really important to get testing in front of you just so you know really what's going on versus not. And for me, I think the 23andMe is the best thing because of optimizing future wellness. If I can get a kid in here under a year old and do all this testing and be able to coach a parent through things to stay away from and such, it's the change or the benefits that you can make at that age are priceless, to be quite honest with you. So these are patient symptoms versus gene expression, right? So we talked about earlier, symptoms and gene expression are not the same. Just because your lab's showing you one thing doesn't really mean that's what the symptom is supposed to be. So the problem with laboratory testing sometimes is the normal ranges are not really set for children, or we don't really know where they're getting their normal ranges from, quite honestly. The sensitivity or specificity of the lab itself, they just might not have as great of technology. Quest or LabCorp don't have the best sensitivity for things like homocysteine testing. The way that they're supposed to spin it down right away, they're supposed to do certain things and they don't always do that. And so it's not the best. Sometimes these labs are not best run through traditional Quest or LabCorp, which is why we order specialty testing. Patient compliance is another big one. Lifestyle, diet, nutrition, medications that you're on can give us problems. And then generalized protocol recommendations. So people posting things online saying, well, this is what we're on. This is kind of a general protocol that we got started on. Those are just things that are kind of hit or miss. So I wouldn't read those things literal and say, well, my kid has the same symptoms, so I'm going to try the same stuff. A lot of times they don't respond the way that you want them to. And then, of course, there's beautiful technical errors that the lab makes that are no fault of ours or yours, of course. And then degradation of the specimen itself, which happens. And we hope that they tell us that and let us retest it versus running it and giving us false reports. Some things to be aware of. Those with MTHFR mutations may not process folic acid into 5-MTHF, which we talked about, right? So we want to make sure that you're giving enriched folic acid foods, not giving foods that are fortified with folic acid. So I always told the story because I think it's a good way for people to know, why did we ever get fake folate into our food anyway? How did that ever happen? And it really happened when we started realizing that neural tube defects, remember the word that's the word that I mentioned, that people with MTHFR have a preponderance or a predisposition to having children with neural tube defects. Well, that could have been what was happening, right? The other end of it was these women weren't taking prenatals, and the government was saying, well, if the poorer population of moms don't have the money to take a good prenatal and can't afford this, and what we'll do is we'll start putting folic acid, we'll fortify the foods that they can buy with food stamps so that they're at least getting the folate in food, so we're not having so many children born with these defects. And quite honestly, it worked. It really did. In the United States, we did drop down our neural tube defects, but you can imagine those mothers with MTHFR were not able to process that folic acid into the methylfolate for their bodies to use. So that's why I think some of these children come out worse than others, depending on the mutation that the mother has themselves. And of course, what they ate, how they cared for their bodies and their unborn child while they were pregnant. So processed forms are really important. We talked a little bit about that. You want to make sure it's a methylfolate or a folinic. If you ever have doubts, don't buy it until you can talk to your doctor. I will always recommend specific supplements for our patients, things that I've been using forever, new things that we're using. I'm always trying to make sure that we're using the best quality things that we can for the kids. And of course, my big thing, because we're adults, right? We can swallow pills. We can't. I always have to give stuff that doesn't smell or taste that bad. You know, sometimes I do better than other times, but I do have kids as young as 3 swallowing caps, believe it or not. It's not impossible to teach them. YouTube is great for that. Number 2 is vitamin C and methylcobalamin interaction. So when you're taking methylcobalamin, which is B12, so those of you that are doing B12 shots or taking it in high dose for some reason, you'll want to make sure that you're not ingesting more than 450 milligrams of vitamin C at the same time, because the vitamin C destructs the methylcobalamin. So it's really something more for your homozygous C6770s. Those are the kiddos with 2 Snips versus those with 1. So just something to be aware of. Folic acid needs to be avoided more seriously by those that are homozygous. It doesn't mean that those that are heterozygous can slack off or that you can, feed them stuff with folic acid in it, but you need to be really serious about avoiding high folic acid in any way, shape, or form. So you'll want to make sure that the doctor's keeping a really close eye on their folic acid levels. And then avoiding drugs that increase homocysteine. I actually gave you a list in your notes of the common drugs. And I'm sure there's more than that, but I gave you the website I found those on as well. And nitrous oxide, most commonly used in dentistry. Believe it or not, dentists are starting to become more aware of MTHFR and the dangers. And I had a parent that I'm going to say maybe scared the bejesus out of her dentist, and I love that. And he actually went home and did a bunch of research and said, oh my gosh, I didn't know about this before. So I think that people are going to find out through you guys going to your dentist and really educating and informing them. I would urge you to maybe find a biological dentist or an environmental dentist. That's typically what they're called if you want to Google them in your area. I see Dr. Daniel Strader here in Dallas. He's awesome. He's an environmental dentist, so he doesn't use anything toxic, doesn't do mercury amalgams, actually removes them in his office. Several of our patients have gone to get their mercury amalgams removed out of their kids' mouths and themselves, of course. So there is something that can be done even if they're in the mouth now. Treatment as an individual, this is super important. Again, please don't follow general recommendations if you can at all keep yourself from doing so. Candida and yeast shut off the MTHFR enzyme itself. So I always tell parents, and so can alcohol, which is, sorry, I put ETOH. That's me in my head, but that's alcohol. It's super important that you know if Candida is present in their stool and urine, and that you make sure it's gone. You really make sure it's gone, because this can give you some problems when you go to work with the methylation stuff. Aside from making it inflammatory in the gut, as you know, some kids get silliness and would die off and things. So heal the gut, make sure that you're doing your lifestyle changes before you take on methylation treatment. I always say that when you're treating the gut issues, that's usually something that you do over a 6 to 10 month period of time. And methylation treatment, sometimes those supplements you're on for a long period of time, depending on how your child is responding. If they're responding to, 3 or 4 supplements to support their methylation pathways and everything looks beautiful and on their labs, then we're going to keep them going that way. So it's really something that may be more long-term than just treating the GI stuff and moving on. So it's really something, like I said, you need to do in the proper order to get the best result long-term. Aside from the candida and such, it does interfere with the absorption of the folate that we're putting in, right? It does require that all the villi that line your gut, that the villi are intact and that they have a proper pH. in that GI tract in order to process it. And you can actually see that on a stool test at how the pH is doing, how the inflammatory markers are doing. So there's a ton of information you can get from doing your urine and stool. Too much methylfolate is not good either, right? Because too much can backfire. And I really should get a testimony from a parent to talk about this, because usually it makes them, I've heard a parent describe it as Jekyll and Hyde, and they just seem like they can't control themselves. So it's always, I always love when either a parent says, well, we started some supplements and we didn't really see much of a change. I'd rather have that and go slowly than have, a parent call me and say, well, they went insane and I didn't know what was going on. So just remember, that's why we want you to be with a doctor. We want you to have someone to call in case it happens, so we can tell you what to do to, I guess, get rid of those symptoms as much as possible. So what else can be going wrong if you're giving too much methylfolate? If you've done a 23andMe, you'll know if you have issues with your CBS pathways, but it can also inhibit nitrous oxide. It can decrease your hydrogen sulfide and your glutathione. For all intensive purposes, glutathione is the one thing I want you to remember from this, because it's the one thing that helps us detoxify. And if it's decreasing because we have too much methylfolate in the system, then we have a problem with our detoxification, right? The biopterin, that's that BH4 cycle. It really has to regenerate and work. They're in circles for a reason. They constantly just go in these circles, and they all have to feed off one another. So more does not equal better. That's something to super duper remember. If you're not seeing any improvement, that doesn't mean give more until you see a reaction. That means just kind of keep steady Eddie. Sometimes you'll see, and I think any parent that's been through with functional medicine or a biomedical doctor, that some things you do are just instantaneous, while other things were kind of a slow progression. I don't think there's anything wrong with a slow progress, as long as there's progress and not, taking 2 steps or 3 steps back to get 1 step forward, which I always warn parents is perfectly normal when you start methylation treatment or support, because sometimes you don't know how they're going to do until you try it, even though it's a small dose. Some kids, you don't know how sensitive they are till you get to that point. So the healthier they are before then, their gut, the better off you will all be in getting them through it. So I want to just kind of recap when we talk about turning off the mutation versus on. So if you increase methylation, you're turning off the gene, which is good. We don't want the gene on. If you're decreasing methylation, you're turning on the gene. Now, you can be over-methylated, right? Because you're giving too much of something. But in general, we want to keep the gene expression from expressing itself and getting upset. So we do that by monitoring you in labs and keeping a close eye on you. So you want to make sure of a couple things. You want to make sure you consume natural foods with folate, which mostly are uncooked high folate foods are the best. So your greens and stuff that kids don't like. For those of you that want an excuse to buy a Vitamix, I'm giving you a perfect excuse right now. Spinach and greens, you can put in a Vitamix with things that are really easy to cut, like a pineapple, even a little bit, because it's high in sugar. You can put a little bit of pineapple, a little bit of coconut yogurt in, and you can make an awesome smoothie with mostly greens that they love. Aside from it being green, it tastes delicious because you can't really taste those greens. So if you can get that in, wonderful. If they're if they've got sensory issues, then you want to obviously make that texture to something they will eat. I always suggest a lid, because it's better if they don't smell stuff. They can smell things we can't smell. We all know that. It's like a magical gift that children have, especially those with sensory issues. They have a nose like a bloodhound. So if you try to sneak something in there, I always say just put a lid on it and keep yourself from having the hassle. If your children have mercury amalgams, then definitely go to a biological dentist to address that. You should consult with your doctor before giving vaccines, any chemical additives in general, and that can be in medications. So consult with your doctor before sedation procedures, because there's testing that we should do before and after, and also some support that we can give right before. I love Epsom salt baths 3 times a week. Great for detoxification, great for relaxing the body. Always great just to stick them in an Epsom salt bath and take them right to bed. Eliminate toxins in your environment the best you can. Natural cleaning agents, all your obvious stuff, right? Your organic foods. This time of year we're spraying for bugs, mosquitoes, things. So don't really ask about ways to do that in your yard versus in your home. There is some natural stuff. I know we use some stuff in the house that we bought, or in the office. We have pets, so we don't use anything in our house at all. But I do use some stuff in my office because I have spider mania in my office and I have serious arachnophobia. But it's actually worked really, really well. And it's something I believe I picked up at Target. They have a lot of good natural cleaning stuff there. Most of the kids that come to see me are picky eaters. So eating a rainbow of colors of fruits and vegetables is like a pipe dream. So that you might be laughing and saying, yeah, that's a pipe dream for me too. So if they're poor eaters, it's because they have GI issues. So again, if you address those GI issues, support their digestion, you really should be able to come out of that with some time. So nutrients necessary for growth and development. We've talked a little bit about some, B vitamins, vitamin C, things like that. Here's just really some breakdowns of, and I know that you're not going to be able to write this all down, and it wasn't meant to be written down. It was really meant to just kind of get the point across. B2, B3, B6, B12, all super important in maintaining those methylation pathways, helping to assist in those reactions. I always describe the B vitamins and vitamin C as the car that drives from point A to point B to point C. And when those are deficient, those cofactors, it really gets messy real quick. Glutathione is another one, of course. Magnesium, important. Copper, I'm actually a fan of copper in a multivitamin. It's why it's in our multivitamin. There's really no clinical science for those of you that have been told copper is terrible. There's no study that has shown that copper is bad. As a matter of fact, for methylation, there's lots of enzymes that are copper dependent. So as long as you're not overdoing anything, you're good, right? And for those of you that are doing urine and stool testing, you'll be able to tell and blood testing with your doctor when you start with them, you'll be able to see all these things. So if I've only seen one kid in several years with high copper, the rest of them usually need it. Magnesium, of course, and selenium and zinc. I won't say most, but there are some multivitamins on the market. You can get all of these things, all your vitamins, all your minerals, active ingredients, minus glutathione. Glutathione you will always need to give separate, but you won't want to give that unless you know you need it, and let your doctor dose it for you. So I created and formulated a multivitamin with all of the things that we just talked about, of course, specifically with my patients in mind, which I think are probably the most sensitive children on the planet in some way or the other. But that doesn't have any gluten, casein, eggs, fish, peanuts, wheat, corn, yeast, soy, stearates, preservatives. Not an easy task. No artificial flavor, sweeteners, or colors either. So what we did do is we put it in a cap form. We open up the caps and stick it in orange juice or lemonade, just like an ounce or two, and they swallow it. It doesn't taste bad at all. It doesn't really even change the color of the liquid. And it has all biologically active ingredients. Anytime you're using a liquid, the gummies are probably the worst. Anything like that as a multivitamin, they have to really put in some kind of artificial flavors 9 times out of 10. As well as sweeteners, and to make it that pretty color is usually artificial color. So the only way to really skirt around that is to give a cap. The other things that are chewable, like your chewable ones, a lot of them are sprayed with maltodextrin from the suppliers, which is a corn derivative. So it's not something that's many times on their labels. And I guess in formulating and manufacturing the last year and a half, I've learned more than I think I wanted to learn about how scary that world is and how much they don't actually tell us on our labels. So it's really something to be aware of. If you are super in love with the multivitamin that you're using, I would just make sure you bring it into your appointment and make sure that the doctor that's helping you with your MTHFR takes a look at it, because you like it and because your kids think it tastes great doesn't always mean it's going to be the best form of nutrients that they need. For proper absorption and utilization, which is the point, right? I mean, there's no point in paying for it and putting it in them if it's not going to work. Another thing is to make sure that they're coming from whole nutrient families instead of synthetics, again, biologically active. I love for you to make sure that they are a GMP certified company. And usually they're only GMP certified. I'm not saying only, but usually if they are a, I'm running out of words here. If they are a pharmaceutical grade manufacturing plant, because the GMP basically is good manufacturing practices. Someone actually babysits them to make sure what they put on the label is what they put on the label. Because the things that you're picking up at Whole Foods, just because they sell it there, does not mean it's good. Does not mean that that what's on the label is really what's in it. Whole Foods, their job is not to make sure that everything is on the up and up. Their job is to make sure they're providing what they think is the best thing for their market. They also provide what sells. Let's be serious. So if what you're using is not GMP certified, you need to switch what you are using. And I would recommend just stop guessing and go to your doctor and ask them, okay, what do you want me to take? This also has the new quatrefolate in it, which is the 6M MTHF, which I'm really excited about, as well as vitamin E, all forms of vitamin K. So super excited about that. You can actually order that yourself through healthykidsnutrients.com. It's called OptiPD. And doctors actually can call our office for wholesale pricing if you want to carry it in your office. So these are drugs. We actually give you this already, so I'm not going to go through it. But obviously, a lot of these things your kids are not on, of course, but I gave it to you as well for those of you adults that need to watch out. So what can you do? We all know that just because it does not mean you'll show symptoms or develop conditions, right, that we've talked about tonight. The genetics are just part of the story. So you have to really factor in environment. 9 times out of 10, long before I ever tested for MTHFR, I knew that something was not going right with a kid when they would come in. Most parents call me because behavior's gotten unbearable. And that does not, after 8.5 years of practice, that still hasn't changed. Most of you can manage or deal with constipation. Most of you can deal with the occasional stomach ache. But when the school teacher's calling you, when the babysitter's calling you, when you're coming home from work, when you've had to homeschool them because they can't go to school, this is when you kind of get, I would say, more desperate in finding out what is going on. And MTHFR is a small picture in a larger, in a larger body. So these are typically things that they have the reduced ability to eliminate toxins and heavy metals. Everybody look for every time I tell my patients that I have MTHFR, they're looking at their child and they're looking at me like, well, you're fine. I am healthy, but I can't eat gluten. I can't eat casein. I'm very sensitive to medications. I always joke that the times that I have to take medication, the side effect list, I always tell like my husband, for instance, I'm the kind of patient, like I was the one in the study that they got side effect from. So if there's a side effect of like dizziness, nausea, vomiting, I'm going to have every single one of them. So I know my own body is very, very sensitive to things in the environment that it doesn't like. But I listen to my body, right? Unlike some people. And your kids are trying to listen to their own bodies too. They just don't know how to help themselves. And that's what you're here for tonight, right? Is to try to get them some help. So it also explains why 2 people can have the same exact mutation and not be affected equally. And I'll have siblings with the same mutation that completely present differently. I'll also have families with multiple children with autism that completely look differently. So don't get too much in a box of what MTHFR should look like. Really get informed about what your child is going through by doing testing as an individual on them yourself. Number 1 priority is testing. So you can support pathways with some of the vitamins and minerals that we've talked about tonight. But if you cannot actually do anything about the pathway because you don't know what's going on, the supplementation may help to some degree, right? But if you can't figure out the other pieces of that puzzle, you're only going to get so far on your own. So I always say there's nothing wrong with getting on a good quality multi, getting on a good fish oil, and kind of starting there. The other part, anything other than that, y'all, I would really, really caution you, even with probiotics, unless you're 1000% positive that it's a good probiotic, I would stay away. These are how environmental factors affect your genetics that we talked about earlier tonight. So I like this little chart because it gives us kind of an overview of everything that we've talked about. So you see diet, toxins, drugs, inflammation, Hypoxia is the lack of oxygen, low oxygen. How the mother cared for the child, both in utero and early in life. Aging and chemicals. And then you go down to how DNA can be affected by that, right? And then the stability and expression of the gene, which is what we look like in person, can be kind of showing up. So the pathology of disease, if you will. So when parents ask me, what supplements do I need to take to fix this? It's more than that, right? It's getting rid of the inflammation. It's doing the work in your gut to get that healthy. It's eliminating any toxins in your environment. It's changing your diet. It's really making sure that we're as chemical free as we can be. So there is so much that you can do without help, right? You can get the chemicals out of your house, if you will. You can get rid of the toxins in your environment by kind of reading the main sources of those. And then you can work to help with supporting them with some basic supplementation. And then, of course, really getting them in to figure out inflammation, diet changes, etc. There's so many diet stuff. We've talked a lot about diet in previous. And I think we're going to do one on some specific diets in the fall. I'm actually teaming up with someone that came to see me. So I told her we do a webinar together. So we're going to co-present a webinar on some of the diets like Feingold and things like that in the fall. So I'm pretty excited about that. We've been putting that together. So I think it's really important for you guys to write down your goals for your child, whatever you're struggling with now and where you want to go, so that when you go sit down with someone, they know and have a clear vision of what you're hoping for, so they can either tell you if, how realistic that is or how long they think that may take. And a lot of times we don't know that answer until we've seen labs. So please don't expect them to give you an answer the first visit, because you're asking us for the impossible when we don't really know what's going on inside their body. I love it if parents keep a record of behaviors, what foods they're eating, how badly behaved they were that day. And not even bad behavior. I'm talking about even behaviors like stemming behaviors or some things that they're obsessed about. So behaviors can be anything, of course, inattention, trouble concentrating, trouble following directions. I'll always tell parents, whatever the behavior is that you're struggling with, find a way to scale it in your mind on a scale of 0 to 5. 0 meaning I had a perfect day with the kids or with my child, and 5 being if they were any worse, I'd have to be taken away in a straitjacket. So what you'll want to do is make that correlation on those days, because a lot of times we can go through your food diaries and find things for you that may help eliminate them for a period of time while we work on testing. So the more record keeping you can keep and the more information you can give, the more we can help. Of course, find a doctor. Please get help. Get on high quality whole food, organic foods is good. Remove fast food and processed foods, especially for MTHFR. Processed foods are big. You'll want to get on supplementation, like I said, with your doctor. Don't try to take on MTHFR supplementation by yourself. And then removing pesticides, chemicals from the home is really, really helpful. A couple places, we take patients from outside of Texas and all over the United States. If you wanted to try to locate someone, you can probably go, I know you can go to Dr. Ben Lynch's website, mthfr.net. I believe he's got a list of doctors that deal with MTHFR on his list. I know there's not a lot of us, not yet at least. So you want to look there and see if you can find someone. And then if not, of course, I'm always here to help if you need. And of course, treatment philosophy is important. This is kind of my treatment philosophy. Some people, some parents like it, some that don't. But I think with MTHFR, I wanted to put this up because I think it's so important that you really are looking at both an alternative and a traditional approach. I think both are really needed in this instance specifically. When you can work with someone who is willing to communicate, I'll tell you, I have a hard time communicating with other doctors, whether it's their time or they don't, they're upset at the family for going elsewhere or, whatever it is. I typically type everything up for my parents so they can share it with whomever they want, so that at least I am, communicating to whoever they want me to communicate to what we're doing and what's happening. And then, of course, if there's any specific treatment that I need to do with the pediatrician, I write them a letter specifically asking them for what they need, attaching applicable labs, etc. So make sure that whoever you're working with is willing to help you keep everyone on the same page. When you can work in a cohesive environment, your child will get better faster. It just is easier that way when everyone is kind of kept in the loop. So, really focusing on your diagnosis of MTHFR mutation is not really going to help you. It's really going to help you to figure out what symptoms you are having and what you may not realize are, symptoms of it, and then addressing those with a doctor. Specifically, someone who is doing integrative work or biomedical or functional medicine. All of those types of doctors are really going to do a lot of the same things that I do as far as my approach goes. So this is the book I told you about at the beginning of it tonight. If you are a techie person and you like to read on your Kindle or your, iPad, that's what I have, then you can download it. And then also we sell the paper copies on our website, also at Healthy Kids Nutrients, and then on our homepage. So that's the Healthy Kids Nutrients website for supplements. And then this is just what the cover of the book looks like. So you'll see it on Amazon too. And you can get it on our website at mychildwellness.com. It's everything that I would want to tell a family. Really from, I'd say, infancy on. I really focus a lot on the developmental delays, kind of where they come from, how to introduce first foods, what type of food allergies are there, why is GI so important. So a lot of the basics that really kind of give you for me, that give my patients education without them having to pay me for it. So it's one of those things I have found it to be really useful in my practice to educate parents. I do not talk about MTHFR in here. Really, because it's such a big law. I think people can just write a book about that alone. But I do these kinds of things instead because by the time I got finished writing something on it, it would be something different. So it's so evolving, ever evolving, that I do these things with you all instead and share my time so we can all be on the same page. The next course is June 23rd. That's tonight, duh. I'm actually, just kidding, I'm actually taking August off. Ta-da! Or July off. I don't remember which one it is. I can't even remember. But I am doing, you know what this is? I forgot to attach the right one. I think I am doing one in July. And I don't remember what it was. But hopefully your handout's right. If not, I'll update it and email it out to you. But you can find our courses like tonight on dramberbrooks.com under education. So you can look. I think I'm taking July or August off. I'm just going to take a month off. I've been doing these since February. We do have a lot of the ones that I've done in the past recorded. So you can go on and see if there's any pre-recorded parent webinars that you want to listen to, you can. And clinicians, I do ones for you as well once a month. So get in touch with us this way. Some of this I talked about in the beginning this evening. And believe it or not, I'm actually finishing early to take questions. This is a miracle. So if there's any questions that any of you have to answer them, if they're specific to your child, I'm not going to answer them because I'm not going to offer any kind of medical advice on a call like this. But if there's anything specific, or I would say non-specific or general that I talked about that you have specific questions about, dip it into your little box and I can answer those for you. And of course, if you know anyone else that you want to share this information with on our upcoming calls, then please, please do share